It's not an excuse for you to allow these things to continue to happen and to allow the public to just accept these things to continue to happen.
Harsh words from lawmakers today who are demanding change following this most recent escape from the state hospital.
We're working for Hawaii. This is the KHON2 News at 6 with Joe Moore.
Good evening, and thank you for joining us on this Wednesday, the 15th of November. After being on the run for more than 72 hours, state hospital escapee Randall Saito has been caught in Stockton, California. Deputies with the San Joaquin County Sheriff's Office arrested the 59-year-old around 8:30 this morning, Hawaii time. Saito, who was acquitted of the 1979 murder of Sandra Yamashiro at Ala Moana Center by reason of insanity, had been a patient at the hospital for more than 30 years. He escaped Sunday morning, chartered a flight to Maui, then took a plane to San Jose, all before the state issued an alert to the public. The director of the health department admitted today there was a breakdown in protocols at the hospital. And now the state attorney general is investigating. Bridget Namata joins us from Kaneohe with more. Bridget?
Joe, Randall Saito has been a patient here for the last 38 years. He has tried unsuccessfully on several occasions to be released. He took matters into his own hands. So far, the state's investigation reveals this escape was meticulously planned.
On behalf of the Department of Health, I want to acknowledge that this incident was a result of a major breakdown in our Hawaii State Hospital staff protocols, procedures, and guidelines.
The state's health department revealed hospital staff may have inadvertently or purposefully neglected to properly notify supervisors of Saito's escape. 7 on-duty workers were placed on leave without pay as the state investigates.
Certainly there'll be further changes we're going to make. This is the first time that I've been aware of a situation where there were several shifts of individuals who apparently were not doing their job. This was clearly, we didn't follow appropriate protocols.
Surveillance footage shows Saito took a taxi from Kaneohe District Park, less than a mile from the hospital, armed with cash, a cell phone, and a backpack. The health department would not elaborate on how he got those, though admitted he had an ID.
Dr. Pressler, are there recent records that show misconduct or inappropriate relationships between Randall Saito and employees of the hospital?
Yeah, those are things I don't think I can address. Those are patient care.
Dr. Pressler said Saito earned certain privileges for good behavior, like access to the clubhouse and off-site adult rehabilitation program.
We've immediately stopped any access off campus for any patients at the moment until we finished our investigation.
We spoke with a hospital employee who said patients have access to a computer and the internet at the clubhouse. Workers also tell us Saito hadn't had a visitor in more than a decade until recently. Saito had 2 visitors to the hospital within the last few weeks. Dr. Pressler said public visitation policies would now be reviewed. The Attorney General is looking into what went wrong and whether Saito had inside or outside help.
The goal is to make sure that he's held responsible for escaping from the state hospital and concerning the public as much as he has. I think it's pretty clear, based upon our filing of these charges, that this was premeditated, it was intentional, it was planned, and this is something that was not done by somebody who was suffering from any sort of mental defect or disability.
As the investigation progresses, more employees may be identified and also placed on off-duty leave. Sending it back to you, Joe.
Lawmakers say it is time for action, not just talk. They're calling for change at the Hawaii State Hospital following Saito's escape to make sure nothing like this happens again. But after so many escapes over the years, can it really be done? Manolo Morales asked the tough questions. Manolo?
Well, Joe, we've heard this kind of talk before from officials here at the state hospital, and there have been some changes, but this latest incident shows that a lot more needs to be done. How soon would you like to see changes happen? And
well, we've already implemented changes, so it's immediately in process. You know, we will go through the investigation to identify exactly what happened.
The governor says changes have begun and more are on the way. Patient privileges will be reviewed, so visits are suspended. The staff will also be retrained, and there will be more unannounced searches of the patients and their property. The governor adds that additional fencing is also on the way, as well as other security measures. I pointed out to the State Department of Health director that we've heard this kind of talk before. Are you confident that after an incident like this that we won't have this problem again?
Well, I don't know if there are any mental health hospitals that have not had escapes.
And for the state lawmakers representing Kaneohe, they tell me more changes need to be done right away.
They've done investigations, we've had hearings, we've had apologies, we need action. The fact that this individual in 2017 went missing for 8 hours before the public was notified, before the residents in the area and the neighbors were notified, is unacceptable. It's time to fix that.
The administration has a responsibility to make sure that in addition to the Attorney General, the Department of Health, the judiciary, who remands these individuals to the custody of the state, it's everybody's responsibility to step up and tell us what will be done to ensure that this does not happen again.
Among the improvements lawmakers want to see is better notification to the public by working with the city.
So I have spoken with Councilman Anderson's office about better coordinating with the city because they have emergency response systems that are much more effective, frankly, than the state systems.
Well, lawmakers point out that the state legislature approved $200 million in funding for the state hospital over the past 10 years. Another $1.7 million 2 years ago strictly for security. They want to see the results from all that. Joe, back to you.
Manolo, thank you. Again, Saito was arrested today in Stockton, California, after officials received a tip from an alert taxi cab driver. That driver spoke with our sister station in San Francisco. Rob Flatido joins us with more.
He was arrested this afternoon here in Stockton, California, and then booked into the San Joaquin County Jail. It's not clear exactly how he got here to Stockton from San Jose after flying there from Hawaii on Sunday. But once here in Stockton, his notoriety apparently caught up with him after he was recognized by an alert cab driver.
But I feel very blessed and that I'm alive, because who knows what could happen.
She didn't realize it at first, but the man this anonymous yellow cab driver picked up yesterday and drove to a Walmart in Stockton so he could buy a new phone was none other than the object of a manhunt who escaped from a mental institution in Hawaii.
I asked him if he was from Stockton. He said no, he was from Hawaii, and that he had took a plane to San Jose and then caught a cab here to Stockton.
He was in another cab today when he was arrested without incident by sheriff's deputies here outside Ernie's Liquors near Highway 99 and Waterloo Road. That was based on information, though, provided by that first cab driver who didn't realize who he was until after she got off work on Tuesday evening.
I recognized him when I was laying in bed and I was listening to the news, and I heard this man from Hawaii escaped. We believe he went to San Jose, and we believe he might be in Stockton. And I looked up, and I was like, whoa. He was in my cab yesterday.
He was committed to an institution in Hawaii after he was acquitted by reason of insanity, a first-degree murder, said to be extremely dangerous even after all these years. He somehow escaped, chartered a plane to Maui, and then flew on Sunday to San Jose. The cab driver said he was headed out of state. Tonight, she's counting her blessings.
He's like, I'm trying to find a cheap car or, ride maybe to the state line. And then he goes, maybe Tahoe or Nevada. And
he will remain here at the San Joaquin County Jail pending his extradition back to Hawaii.
Rob Flatibo, thank you. Saito still needs to go to an extradition hearing in California before he can be sent back here. Once a judge grants extradition, Hawaii law enforcement will pick him up and bring him back, and Saito will be held at OCCC on $500,000 bail. If he manages to post bail, Saito will still be under the custody of the Hawaii State Hospital and be sent there. Saito is facing an escape charge and could be sentenced to up to 5 years in prison if convicted. Again, Saito chartered a flight to Maui shortly after escaping from the state hospital. In a statement today, the charter company, Royal Pacific Air, said, quote, "We are dismayed to learn that Hawaii State Hospital escapee Randall Saito used an alias to charter a flight. We followed all applicable security procedures and are fully cooperating with law enforcement." We'll continue to keep you updated on the need for change at the state hospital, both on air and online at KHON2.com.